We continue our Eyes of March theme and move from eye rejuvenation to eyebrow and eyelash transplants. Joining me now is Dr. Scott Bowden, a board-certified hair transplant surgeon from Hair Restoration and Aesthetic Medicine Center. Welcome back to the show, Doctor. It's nice to have you here.
It's very nice to be back. Thanks so much.
So we're talking about eyes this month because of March, but how important is it to have nice eyebrows, I guess, because they're framing your whole face?
Yeah, it's critical. The eyebrows really draw one's attention towards the eye. I mean,
right.
The goal is when you meet someone, you're introducing yourself, you want to be able to look into their eyes. And if there's an eyebrow issue, if it's too thin or if it's missing, or if there's a scar, it's distracting and you don't really get to connect as well with the person.
And I can tell you because I've overplucked my eyebrows, one of them, and one's very off than the other. I'm always using powder to try and fill it in. So that could be one of the problems. What else causes hair loss?
Well, what you just described, overplucking, is probably the most common reason for asymmetry or missing eyebrows. Over time, if you pluck continuously, you can limit the regrowth of natural eyebrows. I also see patients that have had injury to the eyes or injury to the eyebrow where there's either a surgical scar or an accident scar. People have had burns and those kind of things. A common medical reason for eyebrow thinning is underactive thyroid, and so I always want to inquire if someone has thinning eyebrows. It could be a sign of
a bigger problem.
Yeah, well, exactly. So we need to understand that too.
So what do you do, doctor? How do you fix the problem?
Well, first we would do a medical evaluation. What is the reason? What's the source of your eyebrow thinning?
Hair loss, sure.
Why do you have hair loss in the eyebrow? We can actually do a microscopic evaluation in my office, looking if there are miniaturized eyebrows. There is some medical therapy that may help to stimulate the growth of the eyebrows. If there's damaged eyebrows from plucking or a scar or burn, and we'll see a few patients with those kind of situations, we actually can do eyebrow transplantation.
Similar to the hair transplant that
Right.
we've spoken about before.
Hair transplantation involves removing the hair from the back of the head and transplant it to areas of loss on the top of the head or the front or the top. And eyebrow transplantation is a similar principle. The area in the back of the head, those hairs are going to stay forever. We can transplant them. The care that's taken, the meticulous nature to recreate an angled, subtle eyebrow is really critical.
Great. Well, let's take a look at some pictures because they're very impressive. The first patient here.
This is a young woman who had an injury when she was a little girl. She ran into a metal bed frame, and she had scarring of her eyebrow. You can see she actually has some color there. She has a tattoo that she
tried to fill it in,
tried to fill in the color. But despite that, I mean, there's a lack of an eyebrow. And really the way to cover that is by putting hair in. So we took her hair from the back of the head, transplanted the hairs one by one by one, and created this natural frame for her eyes. So the overall image is you're looking at her eye. Your eye isn't drawn to a missing eyebrow.
Now, it's interesting, you can also do this with eyelashes?
We can. I've done eyelash transplantation when someone's had a burn or someone has absence of eyelashes for an injury or congenitally. You can actually, the same principle, you can remove hair from the back and transplant it meticulously into the upper eyelid and create permanent eyelashes.
Wow, so there's options now.
Absolutely.
That's fantastic.
Yeah.
Let's take a look at some more pictures. And you can see that this gentleman is missing half of an eyebrow, it looks like.
Yeah, this is a guy who chooses to shave his head. He's got very short hair, but you don't notice that. You notice that about 2/3 of his eyebrow is missing. He's actually had an invasive cancer of the forehead, and removing the cancer.
Oh my goodness!
Yeah, exactly.
It completely came back.
So we put the hairs back from the back of the head into his eyebrow. He now has you're not drawn to an absent eyebrow. You're drawn to his eyes.
That is a life-changing procedure there.
Oh, absolutely. I think it makes a big difference in how he's perceived and how he walks about in the world.
And I want to take a look at this last picture because it's so impressive that there's not even really a scar. There's no scar. I mean, I can't see one.
Right. There are different ways of removing the hair from the back. But in this fellow's case, Paul's case, we actually removed the hair one by one by one, and there's no evidence whatsoever of any hair that's been removed. His hair is going to be implanted, it's going to grow forever. In terms of maintenance, what do you have to do now?
Yeah.
It grows, so you need to transplant. Once the hair is transplanted, you're going to need to trim your eyebrows.
Because it's going to grow so much.
It's going to grow, exactly.
Wow,
So
and how long does this procedure take?
it takes a couple of hours. It's done as an outpatient in my office. It's done under local anesthesia. Patients are awake. They're in a very comfortable setting, and their brows may take several months to up to a year to fully grow in, but after that they're growing and they're yours forever.
And you have to maintain them now.
You have to maintain them, exactly. So No mascara, no tattooing. You can just, trim your eyebrows periodically.
All right, Dr. Bowden, you have an office in Wethersfield, and you also are going to be available at the YOLO Med Spa in Guilford as well. In fact, all the information is up on your screen. Hair Restoration and Aesthetic Medicine Center is located in Wethersfield. The number is 860-563-1400 and hairtransplantct.com. Doctor, again, thanks for being here.
It's a pleasure. Thanks so much.
My